Welcome to Two Pete's in a Podcast, where we will talk about child health from birth right away through to adolescence, dealing with issues of illness, development, and everything else that is of importance. Welcome to another episode of Two Pete's in a Podcast. We have done 2 sessions looking at runny noses, and this is the 3rd in the series. So let's have a look today, Mike. How are you doing?
Good, and you?
Right, good.
Good.
Let's have a look at what we're going to do about runny noses. So we've kind of spoken about why it's there and the issues around that. So let's talk first of all about what are the non-medication things that we can do for a runny nose. So obviously the reason we're going to do that is to try and make sure that the airway is clear so the child can breathe clearly through the nose. So,
and also so that we can give you guidelines on how to manage it so that you don't use unnecessary medication that's going to make the child feel worse.
Okay, so how would you handle that?
So non-medication. What we always start with is making sure that the child's nose is clean. And as we went through in the last 2 podcasts, is spray with saline, suck it out. Make sure that that nose is as clean as possible throughout the day, because younger children will not be able to drink properly if their nose is blocked. They will not be able to sleep properly if their nose is blocked, which means that you're going to be more tired. Everyone's going to be unhappy.
So if the child's up and about and running around and it's got a number 11, you know number 11?
No, what is number 11?
When the snot is running down out of each nostril down to the lip, and it looks like a number 11. Okay. In that situation, just wipe the nose. If the child's old enough, get the child to blow the nose. If the child is younger, don't be rushing around with saline at every turn unless the child is actually being really bothered by it. So the feeding is not good, the sleeping is not good, because little babies' noses are blocked a lot. But if we're talking about the situation where your child is a bit ill, it looks like it's got an upper respiratory infection that we spoke about, and there's lots of thick yellow mucus in the nose, and the child is battling and not feeding well, because you can't eat and chew at this and breathe at the same time if your nose is completely blocked. So that's what we're talking about.
So do you have any special ways of getting younger children to learn how to blow their noses?
So if you're sitting them
I've just sprung this on you.
If you're sitting them in the bath and you tell them to put their face in the water and to blow bubbles,
do you trust them not to breathe in?
Well, that's what you want. They're going to invariably suck the water in through their nose, and then you've cleared the nose.
Okay, I mean blowing, not sucking. Mums and dads suck, children blow. Because I sometimes say, like, try get them to blow out a candle.
Yes.
And then you convert that into putting something over the nose and then get them to blow in the same way, but close their mouth.
So just a piece of sheet of paper, or one of those little plastic windmill things that you can get where you blow it and the windmill spins. Try and get them to do that out through their nose as well, so they've got some reward for doing it. Or you can put them in the bath and get them to blow bubbles out their nose.
Okay, rightio. Any other non-medication things that we have? Humidifiers?
So my question always with humidifiers is how humid?
How big is the space that you
Exactly.
humidify?
So if you're living in the tropics and you're at the coast and the humidity is 90%, I mean, how much more humid do you want it to be? Even living up here
in the house.
Yeah, where we are here on the Highveld, even on the dry days, I mean, the humidity is sometimes 40, 50%. So how humid is humid? To your point, a lot of the humidifiers you buy, you stick it in the room and they're sitting in the corner spewing out some stuff.
Like an asthmatic church mouse.
And it's doing nothing. Yeah, it's doing nothing. It's sitting in the corner there. Or the other side, the other part of it, I think, is even worse, where you've got a humidifier that's really working well in a small environment. And then you get condensation on the ceiling, and then the bedding is a bit damp. That's also not great. And my last issue with humidifiers is, that they have filters and stuff in them. And if you're not servicing them properly and cleaning out the filters, I mean, you could be spewing all sorts of rubbish into the air.
So on that though, I have a humidifier at home and it doesn't have a filter. It has a high frequency oscillation pad.
Yes.
And it goes just gases.
Okay.
So I think it depends on which humidifier you have. But yes, absolutely. Point taken. You need to make sure that it is serviced and clean. And you need to have clean, if you can, sterile water.
So my advice to the parents is, I can't tell you with certainty that humidifying the air is going to make a difference. Even if there's a heater on in the room. If you've got an open heat source, like a grill heater or something, then yes, the air might get quite dry. But if you're wanting to use a humidifier, try it. If it makes a difference, fantastic. If it doesn't, don't waste your time.
So
and putting stuff
borrow, we'll get there. Beg, borrow, or steal one from someone.
Yeah.
So something from someone.
Make sure it's clean.
Make sure it's clean, yes, and then try it. If you really want to, then go out, but we're not going to give you recommendations on which one. That you need to decide by yourself. Okay, putting stuff in a humidifier. Eucalyptus drops.
You know,
Carvel.
So I remember from the days playing rugby that you get all these menthol things that you put on and makes your eyes run, and your eyes water and your nose run. And that's all it does. It just irritates the lining of your nose. So I know a lot of mums say they use Vicks and they put it on the feet. I always wondered why they put it on the feet.
Quite far down.
Just that's the point. There's this notion that putting it on the feet makes a difference. No, it just means that the child generally is not going to get their feet into their mouth, or that they've got a baby grow on, so they're not eating the Vicks. But again, my concern with these things is that if it's going to work, that it's going to make the nose run, which is what it's intended to do, as far as my knowledge goes, it's probably what's going to irritate the eyes.
Which is going to make the nose run more.
It's going to make them miserable. So whatever we're using there, there's some drops that you put on the pillows. Again, if it's to keep somebody happy who's trying to convince you to use it and it's not causing problems to the baby, use it. If you find that it makes a massive difference without irritating the baby, that's fine.
Yeah.
But it's not something that I say, please go out and do this.
I agree. Completely.
What I do though, if the children are old enough, warm water, especially hot water with honey in it.
In children over 1 year.
Yeah. If the children can drink out of a glass, hot water with honey and a bit of lemon if they can tolerate it, works extremely well to break down thick, sticky mucus.
It does. It also helps with coughs.
Yeah. So what medication would we use?
There are so many different sinus preparation things that you can get from the pharmacy. And that's the majority of what you have in over-the-counter medication in the shelves. You'll see stuffy noses, blocked noses, sneezing. What we want to use is the least amount of stuff as possible to make sure that that nose is open. As long as you've got an infection, your nose or the child's nose will be running no matter what we give.
Yes.
We just need to make sure that when it is running, it is easy to get out, and that if the nose is blocked, that we can decongest it. If there's snot that needs to come out, that it is sucked out.
Yeah. So children under 5, I don't use any combination cough and cold and flu remedies.
Yeah.
In young children, the side effects of those medications are horrendous.
That sort of stuff has got something called pseudoephedrine, which increases the heart rate, makes them jittery, makes them irritated. Generally, it doesn't help.
Yeah. So the reason we don't use these combination medications is because most of them have something called pseudoephedrine in it. And they either have pseudoephedrine or they have an antihistamine. Now, antihistamines are for allergies.
Both are bugbears.
They're for allergies.
Yeah.
So there's very little role that histamine plays in a common cold or a snotty nose that's not due to an allergy. So putting your child onto long-term antihistamines when it's not proven to be an allergy is of no value. And using old-style antihistamines in children is either going to make them very sleepy and dopey, and in other children it can make them completely wild.
Yes.
That kind of opposite effect. And pseudoephedrine will make your heart race. It can push up your blood pressure. So I really try and use something in the nose to dry the nose, especially for nights so children can sleep.
Yeah.
And there's a chemical called oxymetazoline, which if you go and look at most of the decongestant sprays for the nose that you find, or the drops for babies, contain oxymetazoline. And as long as you're using it 3 times a day, or you're using it mostly at night, you can safely use it for 5 to 10 days with no problem whatsoever. And that's generally the time that you need for a common cold.
Yeah. So use it as and when necessary, but as little as possible.
Yes.
Yeah.
And then obviously, as you were saying, the hot water and lemon and stuff that I was talking about helps for coughing. So, I mean, do you do anything for the coughing? I mean, we know that you never want to stop the cough because the cough is a protective reflex.
Yes.
It's either stopping stuff going down or it's getting stuff in out.
Yeah. The main thing that's going to reduce the amount of coughing is reducing the amount of stuff that comes from the nose down.
Yep.
And so if you're suctioning the nose regularly, and you're spraying it with saline, sucking it out, you're going to reduce a lot of the stuff that's going down the throat. Further than that, the maximum that we would consider using is something called Prospan.
Yeah.
And that's a nice, almost homeopathic type thing that helps to make the mucus a bit thin and helps to settle the cough a bit. But it's not stopping the cough and is not having systemic, meaning the whole body gets affected by the side effects.
Yeah, so a lot of the coughing is driven by the irritation, the tickly feeling you get in your back of your throat, which is caused by the bit of irritation from the virus. And the way I explain the Prospan is when the mucus is really thick and sticky and dry, you can get into these hacking, coughing spasms where you're kind of hocking out a lung to try and get the lurgies out, you know? So if you're using something like a Prospan that's going to make it a little thinner, the idea is couple of coughs, boop, boop, boop.
And out.
Up it comes. And now let's talk about that. Children don't spit out their phlegm, but they do get it out their lungs. They cough it in their mouth and they swallow it, and it gets digested in the stomach. You don't get mucus from the upper airway coming out in the poo because it gets digested before it gets there. So babies and children are able to clear their lungs by coughing, and that's what we're doing with this. We're trying to dry the nose so they can sleep better, they can feel better, they can breathe better, and we're trying to thin out the mucus so that they can cough more effectively. And then always use something like paracetamol, even if there's no fever, because the throat is always sore. Yeah. And the more you cough, the more sore your throat is.
You know, when your nose is full and congested, you feel terrible. Your eyes water. You feel like there's just pressure there the whole time. And the paracetamol helps just to relieve that.
That's it. I think that's a good overview. I think we've covered that quite nicely.
Yeah.
So,
right.
Next time we're going to be talking about warning signs, the kind of runny nose plus. So if your children have allowed you to, thanks for listening.
Thanks for listening.
Thanks for listening. If you found this of value, please be sure to sign up to our email list at www.careforkids.co.za, and that's the numeral 4, and subscribe in your favorite podcast app or follow us on Facebook.
At 2 Peas in a Podcast.
At 2 Peas in a Podcast.
TWO, not the numerical 2.
This is our disclaimer. The information we have given you in this podcast is our own personal professional opinion. We're giving it to you for your own information. Please don't use it to treat yourself or to treat anybody else. Rather, go and see your own medical healthcare provider and follow their advice.